engagement, and how to really engage HCPs in any kind of other audience that we are working with within our omnichannel communication, using all this modern fancy artificial intelligence machine learning approach. So here is our topic of our webinar, really how to connect all this, enable these possibilities, and how to, in best way, in practical sense, use all this kind of stuff that it can give to us, and that we can implement in our projects. So we show you the general overview. We'll really try to cover different kind of questions, so don't worry about that. We will give you some general overview on the more or less basic level, some basic stuff that maybe for some of you is already more or less understandable, for some of you not so clear. Some middle level questions, like how to build rep trigger journey, use some advanced features, some personal content, and also some pretty advanced stuff. What exactly we can use this artificial intelligence and machine learning capabilities in practical sense, in omnichannel, in journeys, in campaign, what is possible on the highest level here. So all currently on your screen, we will try to cover on our current webinar. And at the end, if you will have any questions, and during actually the session, please try to use our appropriate section in your panel that you see, in order to write down there any kind of questions that is bothering you that you would like to answer. And I will try during the webinar, and especially at the end, at the last section, I will try to all answers to these questions as the okay. Let's move forward. So first of all, I would like to give you some services we actually provided, but the current focus here is not only the services that we provided, what services and what like areas could be included in omnichannel project, what kind of, about which things you really need to worry about and take care of. So first of all, of course, you need to have at least some minimal IT infrastructure that will support your omnichannel approach. So we, on this regard, we name three main areas. So first of all, it's CRM, market automation solution, and some content authoring solution that you need to be integrated in one ecosystem in order to work properly. So second stuff is, of course, omnichannel strategy that is crucial for implementation. So you need to understand the general directions that you go into, and after that, transfer this strategic vision into some tactical campaigns, tactical steps. So the campaign execution itself, you need to run something, you need to execute. So just in order to understand that your fancy plans is not only the plans itself, that you really can make some actions on this, really communicate something, really move forward your relationship with HCP, with any kind of other audience, in order to achieve your goals. And of course, onboarding is first of all about the people, about the team that we have. Even I think you understand that even the perfect strategy, perfect vision, and perfect tools will be not so helpful if the team not mature enough, if the specialists cannot do what they should do, cannot interact fully and properly among each other, with some external vendors, and so on. So always like about this maturity level, and you need to onboard all core teams on their project in order for them to understand what we're expecting from them, to communicate among each other, and in order to a little bit raise their awareness and maturity level regarding their omnichannel project, what it's all about, what they can get potentially from this. Okay, so we move forward. So it's just some slides that about our client, just to show that we know what we're talking about, that we are companies them in different levels with omnichannel approach in different senses, in campaign execution, in technical stuff, in strategic level, and so on. So just a couple of words about myself, just for you to be familiar a little bit who this guy who is talking, trying to explain all the stuff about the omnichannel. So I'm omnichannel department in Viseven company, so responsible for any omnichannel campaign that we are running and executing for our companies. Have a lot of more than 15 years of experience with the digital marketing in different areas. So before that, I worked not only with pharma but with other industries, and currently more than 2-3 years I'm running variety projects for pharma and life science companies. So we worked with many clients. Before that, I showed that slide. Okay, so at the very beginning that our journey, I would really like to give some short feedback from your side. So I will just run the quiz. You will see it on your screen with some questions about the different areas that we can different topics that we can talk about. So just please, what is the core questions, core directions, core topics that you would like to be covered on our current session, or during the webinar, or at the end session, and I will try to dynamically adjust to some extent our webinar, maybe to highlight some additional questions that is more like related to the topics that is mostly bothering you and that you are interested in mostly. We get a lot of answers. Just to give you the couple of additional seconds for everyone just to vote. Yeah, almost everyone is voted. If someone else would like to vote, so please just, it's easy. Just okay. I think we're more or less done. I can close the poll and share the results with you. Yeah, so currently we see that omnichannel strategy is the most important topic for everyone. Also, the link between physical activities and digital world, personalization, engagement rate. Yeah, that is a core topic that we'll try to focus. So once again, if you will have any kind of particular questions that is you're interested in, please feel free to use question section or chat, to ask this question currently, and we will try to give you all our answers at the end, during the webinar, and at the end of the webinar. So okay, let's move forward with the presentation. Yep. Okay, so about the top questions actually that we'd like to cover. So first of all, it's how to provide the high engagement with the HCP and influence prescription decisions. And actually one of the core word and core topic just to answer to this question is really this personalization. It's not like just a buzzword that we would like to talk about. It's really the almost the only one, I would say, way how we can break through all these noises, all this, a lot of messages that bombarding currently our audience. And important stuff here is that also we need to take into account that it's only we, like pharma, is addressing different messages, different emails, SMS, and so on. To it's also the other companies, not pharma. It's also the HCPs are human beings, so they really are getting a lot of messages from many companies, FMCG, entertaining, cinema, books. So only when we're personalizing our messages, only when we're trying to deliver more relevant content, more personalized content with HCP, is a chance that will help us to break through these noises and help us to deliver our messages. And it's not only the fancy stuff itself, but also based on our huge experience, the audience really feel it when you even try to deliver this message, and they see that it's more relevant to them, it's more based on their needs and so on. I can give you just one of the like a practical hint, just not only talk in general, but to be more specific, that even when you just include some mentioning of, for example, the city of the HCP that he lives in, will can potentially raise the engagement level like click rate and open rate, for example, if we're talking about the email, or registration rate on the webinars. If we're talking about the webinars, just mentioning the corresponding city of the HCP, so he will understand that it's more relevant to him, more close to his, because we all like localize, and more it's more appealing, yeah, for us to see that it's geographically close to me. We even conduct several A/B tests when we include, for example, the mentioning this personalization by city in the subject line of email, and we get like a 15% higher results in open rate when we just use this city and mentioning this. So trying to personalize this content using some technical capabilities of the market automation platform. So a lot of all core market automation platform has a lot of capabilities for personalization. Also, you can include here some this machine learning and other stuff. We'll show you a little bit later what kind of practical capabilities we have in sense of this personalization using this additional features, and really try to personalize this content. So from a technical standpoint, all this thing is possible. It is there. You just need to understand what kind of content, what kind of modules, what kind of attributes, personal attributes you can use within your message in order to be more personal. So it's not potential there, not only the question of personalizing first name and last name when you just mention it in the beginning of the email. So once again, the geography, specialization, some topic, some like content, some areas that you see from previous, based on the behavioral data of the HCP, that is more appealing to him. Like personalize, one of the most popular personalizations that we build, we're trying to divide on behavioral the segment into two subsegments. So one is more given more emotional content, like a patient story. So, and to other part given more scientific content, like clinical studies, yeah, some scientific research, and so on. So the next question: how to support large brand awareness campaigns? It's really the not so straightforward topic, in sense that it's really hard when you're working not just with, but with RX, with prescriptional brands, with huge awareness campaign. So you should really focus on the you're forced really to focus on your current database and work with it. So the core stuff really here is to work with the database to get as much as possible of your digital consent. It's really crucial because what we call it's as a leverage. So it's how many consents, digital consent you have. It's really to which extent you can leverage your audience and deliver some messages. So we, for example, had some experience working with a project when there was just a huge part of the database was not covered by the face-to-face visits, but the company to some extent was able to get some digital from these users, from this part that is not covered by the face-to-face visits. And we really extend our awareness, extend our communication with this audience by just using only digital channels without face-to-face visits. And it was only with really experience in sense that we saw that to which extent we can influence, we can really distinguish this incremental that is we're getting from this digital channel, because there was no face-to-face visits at all to this part of the database. So we only influencing them with our digital channels and can see what kind of what benefits in loyalty and prescription we are getting from this part of the database. So next question, how to manage, scale, and track digital from global office. Yeah, it's a question of, first of all, it's a question of IT infrastructure and creating some data flows and dashboards. First of all, yeah, but nevertheless, yeah, it's can be a little bit tricky because one of the pretty widely typical situation that the global office set up in different kind of dashboards, but no one use it. So, and the core stuff here is really not, so there is a some tricky some here that there is it's not like a straightforward and a little bit not that has a lot of data, has a lot of dashboards. It doesn't automatically mean that it's better. So in sense of a tracking campaign, you really need to focus on some key metrics that you would try to work with, try to influence, and after that, when you will build in your omnichannel strategy, yeah, going back to this question about omnichannel strategy, try to focus on this couple of metrics that is more or less measurable for you. And after that, the most important skill here is really to transfer these goals into more specific goals. Even if it's hard for you to measure everything, yeah, pretty typical situation, you need to set up some goals. You need to set up some metrics that you will try to focus and try some numbers that you will try to get from each particular campaign. And within this campaign, try to move a little bit further. And once again, use this personalization in this campaign and see how, to which extent it will give you some better numbers in engagement, in open rates, in click, in registration, reducing the bounce rates and subscribe and so on, and try to slowly but surely try to get in better numbers out of your campaigns. And this, like separate campaigns, will at the end of some period will give you some results in the loyalty in prescription. So the next question is how to reduce cost by scale digital activity across affiliates. It's a complex, big question, and here is a couple of key answers here. So the first one is that I already told you about is the leverage. So working with your database, and because one of the option to reduce the cost is really to increase your database. So in most cases, if we're not talking about the face-to-face visits, and if we're talking about the digital channels, you will get your cost per contact will go down if you have the bigger database, because the cost of producing and sending the email will be the same, but the quantity of HCPs who will see your email, who will be influenced by your email, will getting bigger, and the cost per contact for you will go down. So working on this extended database, getting the additional consent is really a crucial part here. So it's the first question, the first option here. So the second option is really try to reuse, to some extent, reuse the content if it's possible. Yes, that is produced by Global, some templates. Reuse the best practices. Of course, you will need to share information among affiliates that just talked with them. And here also the good part when you have just one big vendor who is supporting you with Omnichannel is that this agency working at the time with different affiliates, with different market, so they can naturally by default share this best experience, reuse this template, and give some advice how to reuse the existing content from one affiliate to another affiliate. So it's it's naturally like a connecting, serve as a connector, between different affiliates. It's like a natural role of the agency. And if your current agency that is working with several affiliates at the same time is not giving you this benefit, just ask for them to share it. Ask what is going on in other affiliates, what best practices, what templates, what approach they can propose that they see is working better in other markets, and you will just reuse it. So in this case, maybe you will even save some money or just with creating some additional strategy with engagement some local vendors by just reusing their best practices from other affiliates, what is working in best way for them, and that can also serve you at your market. So the couple of words what actually there is some not it's always obvious for everyone what is in the nature of Omnichannel, what is a holistic market communication approach for pharma that needs to be set up, like a general words that everything should work as a one system. But from practical sense, what does it mean? So first of all, that its all journey should be connected in the way that you have a single omnichannel ecosystem and you have one point of orchestration from which you are managing and orchestrating all and creating the journey and orchestrating all these channels. So if you have and you need to log in separate tool to send the email, in separate tool to send the SMS, in separate tool that send some messengers and so on, and they are not fully interconnected. They are not managed and orchestrated by the one unified let's call it journey builder or tool that orchestrate everything. So in this case, it's really hard to have this to call it omnichannel. And also if one team, even cross-functional team, is responsible for this orchestration, single point of orchestration, they will be naturally take into account different channels, will communicate with different stakeholders who is responsible for different content messages and different even audiences, and they will like naturally by default trying to connect everything together. And that leads to the second point, that in this case you really can personalize message because you are getting this data about the user behavior from different channels. So if, for example, for practical sense, you see that this user already opened your email and registered to webinar within this email, you don't need to send to him the same like a message with the SMS, or ask, for example, medical representative to encourage him to register on the web portal on the SMS. You really see it. At the vice versa, if you are sending the message to someone within, once again, with the email, and see that this user did not register it, for example, on the web portal after this initial email, you can cascade the communication, and after some wait period of 2 days, a week, try to send him some additional message in the email, or the additional message in other channel that once again orchestrated from the one ecosystem or one tool orchestrated, and really try to convince him register there. So in this way, you really are keeping this consistency in brand messaging. You are bombarding them too much and trying to deliver needed messages, and make sure that the message is the same within different channel, because you see it from the one database, one orchestration point, and you really understand that you communicating the same message, needed message, and it's consistent across all channels, across different activities, and across maybe even a variety of campaigns. So in practical, this means omnichannel for us. So also you're also interested, as a second topic, you're interested about the link in this between this physical and digital activity. It's a pretty big question for a pharma, because it's a pretty big gap here. It's naturally, so it's like a separate field force effectiveness team who's responsible for the face-to-face visits and working with a medical representative, and a separate team who is more about this MC leads and so on, who is more responsible about their digital channels. And in most cases, not fully interconnected, and they're not fully even talking to each other at regular basis. So, and the second point where really it's hard to keep this brand consistency and align messages across these two like worlds, because it's really often that the medical representative user in face-to-face visits some one activity, one messages, and through the digital campaign we're not fully aligned, and we are separated like really different, that completely different compared to what we get in the face-to-face visits. So really close this gap and really to bridge these two worlds, it's pretty challengeable. Like our practice, from our experience, what could be done here. So first of all, we need to integrate this rep digital activity into single campaign logic. So we really need to exchange the data between these two worlds, between CRM, if you will. We'll go back to this question about IT. So create this connection between that CRM platform that is a medical representative is working in, and the market automation tool, and really exchange data between them. So from practical standpoint, what does it mean? It means that we are sending back to CRM data about what is going on in digital channel with the HCP, and vice versa. We are sending data about the approved emails, about the remote visits, about the face-to-face visits to market automation platform. So it will give us, first of all, it would give us the possibility to create segment in market automation that's take into account this data as well. and to also to split the logic and like align this logic based on what is going on with the medical representative, what they are, what like messages they bring in. Did they already communicate some topic and really like succeeded in encouraging HCP to do something. And also medical representative vice versa can plan their work accordingly. So we just will open the timeline. I will show you just in a minute the example of this timeline, and see in this each particular HCP timeline what is going on, what activities, what messages we were able or we were not able to deliver to HCP, and he will understand, okay, so already this HCP is visited our webinar about this cardiology, for example, about this our brand and so on, or diabetes, or any kind of topics that we are currently promoting. Yes, already engaged. He already was there. He already has a general understanding, and I need just to give him add some additional information, some maybe extended stuff, some more advanced materials that I already have to my disposal, and vice versa. If I see that this medical as HCP did not open the email, did not register to any kind of webinar, like not engaged at all, almost at all, to previous digital communication, so I know that he's from the very at the very beginning of this communication stage, and I need to start from the very beginning stage, almost for example, in delivering these messages, in telling about even some basic stuff from the very beginning, to just give him just the initial understanding about our topic, our brands, and some communications that we have. So actually that's all. We'll go back to this a little bit later. So as the next slide, I will show you. So it's a real like a screenshot from the CRM. In this case, it's IQVIA or C personal CRM, but it can be the same stuff, more or less similar in Viva, for example, or in different other CRM. So visualization can vary from platform to platform, from system to system, but general idea is that you see here. So in this activity timeline, it's really there. This medical representative can see these touch points and can take them into account when he is planning the visits to the HCP. Of course, it's also required not only technical capabilities, not only the aligning these two pieces. It's also will require from you to onboard your field force, to talk to them, to give them the vision in which way that this data is there. They can expect to see this data there. Give them some hints and some trainings how to use this data properly, how to adjust visit based on this data. So if you have if you will have planning to have a lot of this digital touch point with the audience, with the HCP, so there will be a lot, and they should really be ready to handle this amount of data, to not lost there, and analyze it, use it. So all the data is useless if you're not using, if you're not any conclusion, if you're not adjusting your action. And talking about the personalization one, it is also the personalization. Get this data there, and we need to personalize on the level of HCP, on his agenda, personalize this what he will talk about on this meeting. In this way, he, to some extent, like straightforward or a little bit not so straightforward, gives the HCP this understanding that he knows what is going on, what his communication is going with HCP. He is taking this into account. He is trying to adjust to the HCP needs, activities, and so on. And HCP will feel it, that this medical representative is bringing more personal experience to him. It's more relevant to him, and he will be more open to this conversation definitely in future. So next stuff that is pretty advanced that we implemented in the several projects is building the rep trigger journey. So it's here you see a couple of key points. What is all about? So it's not like it's to some extent similar the mechanism of this rep trigger journey to the approved emails. So we create like office people, office specialists, market specialists, brand managers, and so on is creating the content, creating the journey, the full journey in market automation platform. So after that, we done everything that needed, all the setup in market automation platform, and after that, we make this journey available to the medical representatives. They see this journey in CRM, and after that, it's up to them to enroll each particular HCP. So they will decide whom to enroll and when exactly to enroll. So they will not just trigger that one email, that triggers a full campaign that can have the sequence of some messages, sequence of campaigns that can have not only their email channel there, but other channels as well. So it's more complex, more advanced compared to just one rep approved triggered email. Yeah, so regarding some of this advanced feature, what we have. So a lot of, not a lot of, but couple of most popular, most advanced market automation platforms on the market, like Salesforce Marketing Cloud, for example, one of the most popular market automation tools that pharma is currently work with, or several other platforms that is more similar, has some inbuilt functionality that can help us to work, to be more personal, to be more appealing, and to engage better HCPs to our content. So in sense of technical readiness, all these advanced platforms has the ability to dynamically work with dynamic content and with advanced personalization. So just in order for us to be on the same page, what dynamic content is actually means. So it's when we creating the asset, landing page, email, any kind of other message here with the different blocks, and we enabling and disabling these blocks dynamically based on the subscriber attributes or behavior. So I will give just one of the example, just to be more like practical from this sense, from our practice that we're using. So for example, we're not creating the two separate emails. We're creating the one emails for the webinar as a reminder. And there's a couple of blocks. So for those who is already registered to the webinar, we show in the block that just a reminder to do not forget that, for example, tomorrow we'll have this webinar at 4 p.m. or so. And for those who did not register it yet to our webinars, we disable these blocks and show the blocks with the call to action button to register on the webinar. Like with the same email, you are not creating the variety of emails, you just created one emails and just dynamically changing the blocks. So it will be first of all cheaper for you. It will be faster to create it from content creation perspective, and it could be more like personalized, more appealing, yeah, to medical representative. Advanced personalization is that when we're using some attributes like about the user specialty, geography, some preferences of our users, or his previous actions, and using these attributes, we're adjusting some text, some parts, yeah, to within our content. So once again, from technical standpoint, all this major platform is pretty advanced and can personalize at any extent. So if you have any vision, any like any ideas how to what exactly to personalize. So just ask your specialist who is working with this platform, or your agency who is supporting you with this, just to add this personalization there. So once again, from technical standpoint, it is all possible. So regarding the machine learning and artificial intelligence, what we have from practical standpoint. So what practically, yeah, we can use there. So it's just a variety of stuff. I will give you just a vision with 4 of them. So it's message insights, engagement scoring, engagement frequency, and send time optimization that we are practically using in daily basis within our campaign. But first of all, let me also we'll go to back to this a little bit later. But now, once again, I will give you some also some quick quiz just to ask you to really give you some. You will see the question here. Just give us some your opinion. What really in we can personalize? So just vote here. What can be personalized? Yeah, just vote. What do you think? If you think that it's not possible, for example, to personalize it, yes. So just do not choose it. If you think that it can be personalized, like the first name, last name in the mail, just choose it. Once again, from technical standpoint, what is potentially possible? So we're not asking what currently you are working with, just potentially, what do you think what is possible to personalize and what is not possible? Okay, I think I can close the vote currently, and just share the results with you. So see, you can see the results. So name, just first name and last name is the mail. It's most popular one. So I think that the answer here is simple, that almost everyone is using it, at least from time to time. So it's like pretty naturally that you choose this and you know that it's possible. But actually the answer, everything is possible. All these things that you see can be personal, not on the level of some segment or some bench of users, on the level of each particular user. And it's not like in rocket science in sense of it's all feasible, and it's not really not so. Of course, it will require some time and some effort, some technical capabilities, but still, it's really not so impossible. It's really feasible if you would really so it requires, of course, from you some also some content, some thinking about the tactical, about the strategy of which part you can personalize, which part of you see how to personalize, like what exactly we need to put there. But everything is possible here, and we not just like hypothetically know this. We use all this in practice in different campaigns, in different projects. So here I would just would like to show you the example. It's not from pharma. We'll go to pharma example a little bit further, but just how in other industries that is in this sense more mature compared to pharma, how they personalized their campaigns. So you see the some part of the email from this airline company, and this part that is you see that underscored with the red lines, it's all dynamically changing and dynamically personalized to the each particular subscriber at the time of sending. So this like a date these locations that he or she, this user visited, yeah, the images of these locations, yeah, how many kilometers, yeah, they flight using this yeah, airline companies. All this part is dynamically personalized to each particular user, and the user see it, user understand that these numbers it's relevant to him, that is about his experience, his history of engaging and working using this particular company. So this level of personalization is really like a good example targeted that could be as a target to us, to pharma as well. Next one is real, once again, real example from pharma that we used. It's our own example that we used. So what you see here. So first of all, it's not like as approved email. It's not like it's not the it's not sent it from the CRM. It's sent it from the marketing automation platform. So first of all, we use the name of the medical representative, key account manager, whatever we are calling them and using. So we use the names in the sender profile. So it's from name, not just from general, from name from the company. It's dynamically changing within each particular corresponding medical representative, each to HCP, based on which medical representative he's working with, this HCP. So it's dynamically changing. Is from name. Also, you see that like normal, yeah, personalization by the first name and last name in the email itself. Also, we use this changing a call to action button. I give you, for example, before this example with a webinar. Also, we dynamically, you see this block at the footer part, yes, that it's block about the medical representative. So it's his photo that once again dynamically changing. It's his signature, first name, last name, email, like a personal work email that is clickable, that HCP can click and directly communicate to this medical representative. And once again, we're not created like a 50 version of email. It's not like a 50 templates, 50 assets. So it's just one email. And this email has some block that are dynamically changing based on the HCP data. So also as like on the short part here, you see the landing page. It's the landing page that we are actually collecting some feedback about the appointment. So when exactly the HCP would like to have a meeting, appoint the meeting with a medical representative. And so we also gather data here and there, and also include there's a block with that is dynamical block about with a photo, first name and last name and email address with particular medical representatives. One landing page that has just dynamically changing blocks. So the three top features that I mentioned previously: send time optimization, engagement frequency, and engagement scoring. What is all about? So send time optimization, I think from the name of this feature, you understand what is all about. So it's about that the system using the machine assigning this personalized best time of sending the communication to each particular user. And this send time is based on this algorithm is optimal in sense of maximizing the probability, the chance of open, click, register, and any kind of other engagement point that is important for us. And after that, I will show you the example. We can not only see this on the reports, we can also use it pretty easily, yeah, within the journey. We have the separate action element that is responsible for this. So the next report is next feature is engagement scoring. What is doing is dividing the dynamically dividing the audience into 4 major groups based on the behavioral data, historical behavioral data. So the first group is dormant users. It's not active users who's actually not engaging at all or to really low extent with our communication. The second group is called window shoppers. It's the users who is more or less often opening our emails. So currently we're talking about the emails, but the similar functionality exists for other channels as well. So this window shoppers is opening email pretty often, but not clicking. We call them surfers also. They like quickly surf through the different emails and go next. So selective subscribers is users who is more or less often opening the email, but so not so often opening the email, but when they open, most time they will click. And the loyalist, I think it's understandable. It's our core audience, most valuable from the engagement standpoint. So it's users who is in each particular communication, and most of our communication is engaging actively with our messages. So all of the stuff we can not only analyze, we can practically use it. I will show you the example of the journey a little bit further. And the next report that I would like to talk about is engagement scoring. So the engagement scoring is trying to link, the journey itself, trying to link the two main metrics. The first of all is this engagement rate and the frequency of our communication. How many emails or how many other messages we are sending to our audience during some period of time. And if the system, and they build this like a strong correlation between these two variables, two metrics. So if a system sees that your engagement level of this particular HCP is going down in each particular next new communication, like an third email, fourth email, fifth email, and so on. So it will notify us, give us the put this user into the corresponding subsegment and mark this user as a little bit oversaturated. So we need to think about the little bit hold on communication to this user to not hit him, to not bombard too much to him, not bombard too much him, and not to turn them into dormant, because after that it will be really hard to wake them up, to re-engage them in our communication. And vice versa, if the system sees that the engagement level is not going down at all, so it will treat this user with that it's we can send them more or keep the same pace. So, and as I told you previously, these elements this functionality not exist not only in as a reports, it also exists as actionable elements in Journey Builder. In this case, we're particularly talking about the Field Force Marketing Cloud. So you can drag and drop and build the journey, use these elements. And so, for example, if you put this element of the Einstein send time optimization right before the email, it will send this particular email to each particular subscriber, HCP, to the most suitable for him or for her time. And since in engagement suite, it also you split you there into even four branches in our journey, and how we can work with it. We can, for example, send to everyone, for example, really the crucial mandatory part of our some messages, and additional, maybe not so crucial messages to emails to those who is almost saturated or oversaturated already with our messages, that we need to wait a little bit to not to not oversaturate them and not to turn them into dormant part. And with the engagement scoring, this persona split, we can really as I explained before, with this loyalist, like subscriber, window shopper, and win back dormant part, we can also split them into 4 groups automatically and treat them differently, like send them a little bit different content, or even to create the separate logic, separate branch with a separate logic for this part of the audience. So in this way, we really try to be more personal, more relevant, and take into account each specific needs of the each user of each small subsegment of user, treat them differently, and this will naturally will boost our engagement. And sorry, the last quiz that I would like to send to you, it's the question about the first product. What, in your opinion, in your practice, in your vision, what should be the first 2 stages of product realization? Just trying to vote. Just give your vision, your practice, and your guess probably in this regard. Okay, I think everyone who would like to do it, more or less already voted. So I can close the poll and show you the share you the results. So of course, the technical infrastructure is pretty obvious. So you can of course start with some strategy, but if you don't have this infrastructure, how you turn the strategy into practice, how it will just stay just with a fancy presentation and not told you really need to think about this execution. And we all understand that building this ecosystem is not like a question of 1 day or even 1 month. So you really need to start working on this, and after that, in parallel, you will have more or less enough time to work with the strategy. And of course, if you almost anyone has at least something currently. So in order to build some best strategy for the future, it is the best to analyze what currently do you have, how good you are in current situation, in what aspect is not so good for you, what can be what improvement can, in which aspect should be more you need more focused in your strategy, what you need to improve, and what is you just need to keep as you have currently. So the next year, it's just our end-to-end solution of groups of deliverables you can potentially get from any kind of fully omnichannel services. I will not here go to all of this. You can just see it on the screen. So all these parts is more or less crucial to any kind of omnichannel project. So you need to work and to pay some attention to all of this expect some of part of this stuff you can internally, but by internal resources, some part of this you can only get from, maybe you can outsource to some agency or some other vendors and so on. Yeah, so just a quickly couple of slides about us, that we have a lot of offices in different countries and cities. So we're a pretty worldwide company. Yeah, so working with a different technological partner with IQVIA, with Viva certifiers, working with different other platforms as well. Yeah, some inspiring words for you. And I think, yeah, so here you will see there you can use this QR code and go with some additional articles that can be useful for you, and just go through it. Yeah, you can just scan now these QR codes and go through the link to these articles to make you, if you don't have the just time right now, you can save it in your bookmarks and read further this stuff. Yep. Yeah, so it's about myself, my work email. So if you have any kind of question, you can also book a meeting with us, send us any kind of questions, any kind of request. We're ready to share with you all experience that we have. Yeah, okay, so now I can switch to questions that we getting due this time. Can we get a recording of this presentation? Sure. You will get the recording in the follow-up after the webinar. Data on how much the personalization have on the prescription. Yes, we have to some extent. Of course, you understand that it's hard to measure because it's like a long run, and as you all understand, the hard part in the pharma for all of us is that we're not e-commerce. HCP not directly buying from us anything. We're just working on their loyalty, on this communication on daily basis, day by day, year by year. What we have done, as you see, we have done a couple of bunch of different A/B tests and tried to measure really how this personalization influence on engagement, and after that, or on prescription. Told you previously during the webinar, we have a couple of let's call it natural A/B test when we have the digital communication with some part of the database that is not at all covered by the face-to-face visits, and we see what kind of incremental we are getting from this digital personalized experience that we're trying to deliver to this part of the audience. So we try we get this data from first of all with the database, and after that, after the 1 year of working with this project. So we saw this. So of course, in some cases, if we're talking some different features, different personalization stuff, of course, it's not like a magic bullet in sense of that we will put just like this specialty mention in the email, and it will boost like a 2x the prescription. But it's like our core mechanism of building more engaging communication day by day, and just improving our communication, winning this race of for attention, breaking through this noise, and getting better results. So it's not like it's a quick win. It's really the marathon, of all this journey, and really working on this presentation stuff, experimenting, creating some A/B tests, and so on. Do you need an unified data layer and way to identify customer across channel and orchestrate the journey and measure it? Yes, we need. So the one if we're talking from technical standpoint, between multi-channel and omni-channel, that is, in omni-channel, we are binding data to the contact, not to the channel. And when we have the multi-channel, we have contact in separate channel, so we have data that attached to the channel, and we don't have this unified, yes, degree overview of the user. So in order to be fully omnichannel, we really need a data platform. Yeah, we really need to put all the data to the content and see all this data in one place, and not like a separately in different dashboard and different platforms. Is the engagement score done channel by channel or done for overall? It depends. So in most cases, when you work with inbuilt solution like Salesforce Marketing Cloud, if it has different dashboards, different features for separate channel. If you are trying to work with the custom approach, so for example, when we are implementing this approach to by ourselves, let's call it more like a more custom way, we are trying to create the engagement scoring and give the different weight to different touch points, and use this engagement scoring across all the channel, across all the touch points, across all the communications that we have. And after that, when we build this like as a baseline, we're trying to put this machine learning algorithms on top of this. So this algorithm, first of all, is this adjusting this scoring model, and second part is they try to give us predictions and more sophisticated, more advanced reports on how good we are on achieving this more personal approach. Channel by channel, is engagement score CTO extracted from the Salesforce Marketing Cloud? It's inbuilt functionality in Salesforce Marketing Cloud. You just need to set up it, and after that you will see reports directly in Salesforce Marketing Cloud. But it's also possible if you want to get this data by API, yeah, from the Salesforce Marketing Cloud and visualize it elsewhere. But we mainly try to use it within Salesforce Marketing Cloud, see this report there, and use this reports there in Salesforce Marketing Cloud, and like from on tactical level, day by day analyze these reports and adjust our approach and adjust our communication. It is look great, but how do you actually start and most importantly implement the process within the company? It's a big elephant. Yeah, so we need to build it piece by piece. And actually, it seems really complicated. It seems like a little bit too much, huge approach, too many steps that need to be implemented, and so on. But you really need to start with something. And our experience is showed to us, if there is a will, there is a way. So we're just creating this implementation plan and just implementing it phase by phase. So we're not, of course, going through some advanced feature from the very beginning. So we set up something pretty basically, and after that just move forward. And this movement, it's really fully depends on your side, on clients, on your resources, on your budgets, on your willingness to go fast. We have the experience just when we're within like half of the year from scratch, build pretty advanced solution, and it's not only for the big pharma only. So pretty like a mid-sized company can also afford it. And we are currently has one of the project for the mid-sized company in France that is like building absolutely from scratch all the omnichannel approach from the very beginning, from building the database, implementing marketing automation solution, integrating with the CRM, starting some campaigns, going to some more advanced campaign, adding new channels. So we just eat this elephant piece by pieces, and we're just creating this project plan and try to set up some goals to each this phase. what specific do you need to get everything going? What specialists do you need? From your side, I mean, from pharma side, we need some tech guys that will help us to build for you this ecosystem. And second one, we need any kind of MC lead, multi-channel, or any kind of this guy who is responsible for the digital communication, and maybe someone from, I don't know, from commercial excellence and so on, who is more responsible for the operational model, from setting up some processes for this communication part with this back and forth with the global, local affiliates, with us, and so on. So this main person is minimally more or less enough, at least to get started and to do something. Can you tell us how do you handle the MLR question in practice? MLR, yeah. MLR, yes, it's can be pretty challenging for pharma. What we have seen, just once again, I will repeat this famous phrase: if there is a will, there is a way. We saw that it can be the issue, and what is really that within the same country, but different companies, the MLR can treat it differently, and also within different countries within the same company, MLR can treat it differently. Yes, so there is always a possibility. There is always, as our practice is showing, that is there is even possible to work with the dynamic content. If there is a will, the process for MLR can a little bit be more longer, a little bit more complicated, or be more easier from company to company, but it's all manageable, especially if you have some approval, some digital asset management platform like Promomat or so in place, and if your legal team is really at least a little bit open-minded and really trying to focus on solution and not just to ban everything and said that it's not possible, let's just quit it. So it's more or less all, I suppose. If you don't have any kind of other question, if you have, just you can you can send it to chat, to question and answer block. If not, it's okay, and it's so we appreciate your attention, that you stayed with us this more. Once again, if you have any question further, ask the contacts. You can scan the QR code or the my work email you see on your screen, and you can directly to us, and we are really will be glad to give you any kind of our consultancy, vision, ideas, anything that we can help you with. Okay, so thank you. I appreciate your presence in our webinar, and take care. See you next our webinars.